We can see what happened here, that when his foot is actually planted onto the ground, and then you can see that his body is now pivoting and twisted, and then he fell directly in front. Hello, I'm Professor Paul Lee, ACL and cartilage surgeon. Today we're going to have a look at a 24-25 most talked about injury from Gabriel Jesus in Arsenal. Here we go, let's have a look. Ooh. Right, we can see what happened here, that when his foot is actually planted onto the ground, and then you can see that his body is now pivoting and twisted, and then he fell directly in front. You can see that once again from a slightly different angle. Oh, that's a very, very big injury there. You can tell immediately from the way that the body is landing onto the ground, and actually the way that the foot is stuck onto the ground and twisted and pivoting. This is the exact mechanism of injury, classic textbook injury for ACL rupture. You can see that in this zoom in videos here, you can see that that foot is really planting and causing that change of directional force here. So looking at this injury, it is likely that he's going to be out for quite some time. He's going to be out at least for 9 months for typically ACL injury, if that is going to be dealt with immediately. Of course, it most probably will. Most likely that we will be doing ACL reconstruction for him, but also it is possible for biological repair and actually saving the ACL. So typically with ACL injury, people used to take a hamstring graft or maybe a patella graft. On the sportsman, most typically people will be using a patella tendon bone graft. However, that means that we weaken the patella tendon, or if you're taking a hamstring graft, we weaken the hamstring. And of course, in the footballer, it's very important, right? So actually, typically on premiership level, we'll probably be using what we call allograft from a dead person. We're using it from a tibialis anterior, which is one of the fat tendons that you can feel on the front of your foot. And that is usually what we use to hold that things together. That will actually speed rehab up quite significantly. Of course, depends on the surgeon, the experience and expertise. They may prefer one thing over another. But if it's me treating the patients, I would actually use an allograft because it will help him to recover quicker and he can actually come back before the next season. So looking at this injury, it is actually quite significant. He ruptured his ACL, but actually what's more important is the cartilage and the meniscus. The ACL may be reconstruct or repair, but actually if there's any damage to the cartilage and the meniscus, if that is not looked after and repaired appropriately, it actually will cause more long-term problem and will lead to arthritis. That's one of the issues that as a footballer is often predisposed you for arthritis for that reason. And it is something that we need to think about and want to treat it biologically to actually enhance our body to heal. And this is a very important point for even any injury within the knee. You need to consider about the other structures. So look, this is a knee mannequin that we're showing. You can see the ACL is right here in the middle. So when the injury actually happens is when the foot is planted, then the femur is twisted out that way. The knee is kind of partially dislocated into the area that we can actually push down. During that time, you can see that it has been pushed from the joint here, the meniscus, which is the blue thing here, that also get ripped at the same time. So you can imagine that when the meniscus is ripped at the back, and also the cartilage at the back here impacted into the front of the joint, and that will cause damage, and the forces going in there is quite significant. It's a whole body weight with speed pushing onto that. It will give enough energy to kill the cartilage, to kill the cells. So this is what will cause long-term problem. So I'm Professor Paul Lee. Stay young, be strong, live forever, and subscribe to my channel.